Hello and welcome to the first installment of Faces of JAF, where you will see and hear firsthand stories from those who represent the organization as a whole. Today, we will be speaking with Shannon Gallanty, Program Manager of the Joe Andruzzi Foundation. Shannon, thanks for joining us.
Thanks for having me, Jen.
Shannon, can you first explain what your role covers as Program Manager at the Foundation and how patients apply for financial assistance?
Sure. So I've been in JAF now for a little over 4.5 years, almost five. It was a quick 5 years. But I am, the main contact for our healthcare partners who I work with daily. They submit the applications on behalf of the patients. We partner with over 120 hospitals and cancer centers throughout New England. So patients can go to their social worker or resource specialist, financial advocate, and they are really the advocate on behalf of the patient. They submit the applications and I, review them, work with them, assign fundings, doing all that, really making sure that the money gets out the door into the hands of the people that really need it in as fast and efficient a way as possible. We also do a lot with patient navigation and assisting patients and being a voice for patients and trying to learn from them. So that's more, not so much the day-to-day, but it's a really important part of JF, and I think something that makes us stand out compared to a lot of other foundations.
When patients apply, they go straight to their healthcare professional and go through our online portal, correct? That's everybody kind of goes through that way.
Yep. And if they do reach out to us directly first, I usually just advise them to reach out to a social worker or similar professional. And if they, don't have one or they're not working with somebody, we really try to encourage that they do that because we know that social workers and other professionals, they can help with not only JAF funding, but they might have some other resources. So, we really advocate for patients having that connection within their healthcare team.
Yeah, such an important relationship for both sides, for the care team and for the family. From your perspective, what has changed and what's the evolution of working with social workers and healthcare partners?
I think it's just the awareness of financial toxicity in the space. When we started, I wasn't even really using that term financial toxicity, and now it's something I use in everyday conversation. And the need is just growing so much. The application numbers year after year after year are increasing. There has not been a single month or that it was lower than the last. I also think one of the things that I've particularly noticed in the past 5 years is there has been a lot of change and instability in the health insurance, health coverage industry. So I think there's been a lot of changes for a lot of people, and it's made people realize that people of all socioeconomic backgrounds need financial help and they feel the strain. Honestly, cancer does not discriminate on anybody's financial situation.
Yeah. And to that point, it's kind of, our world really, it's not even our nation, our world is really seeing what a pandemic does to, families and the economy, and not only just by people being stricken with, COVID-19, but just what it really can do to families, financial stability. And for the Joe Andruzzi Foundation, that's something that we were focusing on for a community that was already in that financial hardship and now is getting even hit harder, right? So if one spouse was working and now that spouse can most likely not work because, the immunocompromised, they're, not them, but the patient within their home or a layoff. And like we say, like cancer doesn't stop, right? So even though there's a pandemic, these patients, there's no pause button. They still need the treatment and they still need the resources. And, the sad thing is that in the time that we're in right now, they don't get those options. And now, they already had financial barriers, those financial barriers that they're just getting higher.
What's going on now is kind of giving people a taste of what, some patients go through on a day-to-day basis, because it was something I hadn't even thought about is one of the patient recipients' mothers we were talking to said, we always have to worry about my daughter's always immune compromised. I have, for the last 2 years, I've had to worry about it. When we go to restaurants, we already wipe down, I mean, now nobody's going to restaurants, but she was saying before this happened, she was saying, I already have to wipe things down, and I already have to worry about her immune system because cancer patients are so susceptible to anything, to, just the common cold or the flu could really set somebody back. So, I mean, this is obviously on a much higher level, but, I think the way that now we're all very conscious of what we're touching and who we're interacting with, that's something that patients have had to deal with long before this even started. So it's definitely more heightened now, but it's something I took for granted, not having to worry about, going to the grocery store and washing my hands right after.
Right. Yeah. No, absolutely. Can you tell us what you're hearing from healthcare professionals and partners as they adapt to COVID-19?
Yeah, absolutely. I would say the biggest thing is just there's a lot of uncertainty, not only for, all of us working from home, but now social workers, some are working from home, some are in the hospital, but a lot of patients' appointments, if they aren't necessarily time sensitive, are being pushed off. So they're not able to come in and get some of the services that they might normally. For the most part, what I've heard is most medical procedures and appointments that are critical, they're still happening, but anything extra like support, resources, both financial and emotional, those are really hard to come by during these times. And I think everybody's doing their best to try to offer services remotely, but I think people, and especially the cancer patients, are really missing that face-to-face interaction with people.
And have you found that each partner has kind of adopted a different, work from home? Some are in still in the facilities, some are working from home. So, even if a patient was to go in for a doctor's appointment, it doesn't necessarily mean their social worker, financial navigator is within the institution to even see them face to face.
Yep, absolutely. I even know that some of them, they might be in the facility, but because of COVID-19, there are a lot of different needs that the hospital needs. So sometimes they're not actually acting in their social worker or financial advocate role because there's so many other complications going on with this right now. It's preventing a lot of healthcare professionals from doing the resource navigation that they really specialize in.
Yeah, I can't even imagine patient role or healthcare role or caregiver role. So switching from how the facilities and the social worker have had to adopt new practices, what has it been for you to work from home? How has it changed?
It was definitely an adjustment. I feel like I'm still trying to get in the swing of working from home full time. I was lucky that I was able to bring all the technology needs home with me. I now have my printer on my kitchen table, and I've kind of set up office in my living room. It's also, it just gets a little lonely. I think everyone's kind of experiencing that right now. I'm somebody who's usually around at work. Everyone in the JAF office is really close and really used to seeing each other all the time. And I think this is as long as I've gone without seeing everybody since I started. But work-wise, I'm very, very lucky and fortunate that the program is able to function remotely.
Yeah, absolutely. I think we are one of a resource nonprofit that really is able to bring home the mission and still fulfill it. What are some things that you have done to keep yourself upbeat and positive?
So work-wise, one of the things that I've been enjoying doing is I have interviewed some patients in the last few weeks for patient profiles, which has been good, and actually getting to hear a new voice and talk to people and, write their story and say how, JAF helped them. That's a big impact for me. But then just on a personal note, I've been trying to remember to shut off my laptop at a certain time and have been reading and just watching a lot of, Netflix, like Tiger King, like the rest of America, I think. um, and I was like, I just feel like I need to keep my hands busy. I'm feeling so antsy. So I bought a lot of adult coloring books and crayons and color pencils and stuff. And I honestly probably have not colored since I was 10, but it keeps me busy at night. So I think I've kind of reverted back to things I liked when I was younger, just to try to keep your mind off it.
It's a very good point. You have to bring out the inner child sometimes too when we're in these really tough times, because kids, they're so young at heart and they don't understand what the bigger world is. And I think that as we get older, we know those things. So making sure that we take that inner child a little bit, pick up a coloring book, do things that are silly and fun, like it makes it makes the days a little bit lighter. Shannon, thank you so much for being a part of the organization. We're ultimately blessed to have you. We could not do what we do without you. I know that for a fact. So thank you very much, and thanks for joining us on Faces of JAF.
Thanks.